talking about are subtle, some would say intangible, difficult to measure and to check. I'm wondering, how much is this a natural talent that people have, and how much of it is something that you can actually learn? Are we talking about skills that can be conveyed and practiced and refined, or these are things that you have them or don't? What's your idea on that?
Well, maybe I can comment a bit on that from what we know from regular psychotherapy research. Unfortunately, we know that, you know, the length of a clinician's experience doesn't necessarily translate into better therapists. So it seems that these therapist factors, or intuitive factors, as you say, they do play a big role. But I think it will be extremely interesting within this area to begin to look at, you know, characterizing specific therapist behaviors that we want to alter by training them, and then testing if that actually happens. So as it stands right now, I don't think we really know in the scientific sense of knowing.
I have an anecdote from our training program. We've trained over 1,200 people so far, and most of the years we've done interviews. A couple of the interview questions are obvious, like have them talk about why they want to be trained as a psychedelic-assisted therapist, what will they do when they get done with the program, etc. One we have weighted more highly is, does the interviewer, who's a seasoned person, a person who has been teaching or been a mentor themselves, does that mentor feel comfortable with the idea of being the participant with that individual who's being interviewed right now as they are? So we're asking our interviewer to use intuition about whether they would feel like there's a there of someone they would feel fairly comfortable with guiding them with a psychedelic. And we weight that higher because we found that our interviewers were fairly good at guessing that. But when asked them to put words to what they're looking for, they were all over the map, and it did drill down to something we called clinical intuition. But we've had a really good track record in the types of people we've led into the program using that as a marker.
I appreciate you bringing that in, and also the psychotherapy research part, because I think we can really also learn from like the body of psychotherapy research, which was not specific for psychedelics, but we can learn a lot, so we don't have to repeat everything. And then also this like foundation of principle attitude or competence that you bring in, that like openness and also humbleness. And then still I think, like once a teacher of mine and from the psychotherapy training said, then be the most experienced patient in the room. And I like that very much. And I think as you go along, you might come with a fundament of openness and humbleness, but you can, for example, learn to be more present, learn to be more okay with things you don't know, learn maybe to reflect on your immediate judgment. So there's a lot you can learn on the way, and I guess that continues. I don't know yet, but I hope. So yeah, there's a fundament, but on top, I think it's really about this process and being open and really also being okay with not knowing, and maybe, yes, we can do mistakes, but that's inevitable, and be okay with trying things out and also be wrong and get into the contact with the people you accompany.
That's all excellent. I would add being able to self-reflect on our own narcissism and our darker sides, and being willing to get clinical supervision or peer supervision for that. A lifetime of inquiry,
And you might also trained to be able to deal with your own anxieties about the process of the patient, and to deal with your boredom during the session. You might not do anything, and you know, and also deal with your ambitions to produce a positive experience in the patient, which is not the right way to do it, I think. So you should leave it open to the patient's soul to unfold in whatever direction, and you might somewhat therapeutically handle that. But these issues are there too.